IVF, or in vitro fertilization, is basically another way to introduce the male sperm to the eggs, and we do so under various conditions. We take them, we introduce them on a laboratory dish, and this is mainly because of infertility purposes.
Depending on the cause of infertility, you and your partner might try a less invasive treatment option before attempting in vitro fertilization, including fertility drugs to increase your production of eggs or uterine insemination, a procedure in which sperm are placed directly in your uterus. Occasionally, in vitro fertilization is offered as a primary treatment for infertility in women older than age 40, or if you have a pre-existing health condition such as fallopian tube damage or blockage, which make it difficult for an egg to be fertilized or for an embryo to travel to the uterus. An ovulation disorder, which means fewer eggs are available for fertilization, or a genetic disorder which may put you and your partner at risk of passing it on to your child. If any of these situations apply to you, you are a good candidate for IVF treatment.
IVF is basically done under 5 major steps. First, we ripen the eggs. So we administer certain drugs to the patient, such as FSH, follicle stimulating hormone. This is done in order to stimulate the follicles and bring the eggs to a certain maturity before we can retrieve them. Once it's time for the egg retrieval, we use ultrasonography to guide a thin hollow tube into the upper vaginal wall and into the targeted follicle that has reached the right maturity. We retrieve the eggs, and then we introduce the eggs to the sperm on a laboratory dish. They are left incubated for a certain time in order for the eggs to be fertilized. Sometimes this does not work, so what we do is we take a single sperm and we inject it directly into the cytoplasm of the egg, and usually that gets the job done if prior IVF treatments did not work. Following the fertilization, we grow the eggs into embryos, and this is where it gets very challenging as well. Is we have to do so under various conditions, under cultured media that is to simulate the woman's physiology, and this is a kind of a problem because it keeps on changing. The woman's physiology keeps on changing during this period of time where the egg is fertilized. So following the growth of the egg into an embryo, we reimplant the embryo into the uterine lining. Sometimes we actually need to also use assisted hatching, because using IVF will cause the shell, or the zona pellucida of the blastocyst stage to be very hard, and so we use a fine laser to make a small hole into the zona pellucida for the embryo to be able to exit. We can also use acid tyrodes, which we use here in the clinic as well, in order for the embryo to be able to exit out of its zona pellucida. One thing is to be taken into account, though, is before the treatment begins, we take a look at the male sperm.
So once we have analyzed the sperm, if men find that they do have reduced number or morphology or count, there are a few things that they can do. One thing is diet. There is actually an impact of diet on sperm quality, and there's a certain vitamin regime that they can follow, taking selenium, zinc, folic acid actually for men as well as women. And interestingly enough, they really do need to watch their carbohydrate intake and proteins and fats. They need to be eating a balanced diet. We had a anecdotal study, and it has been proven in the research now, that a diet very low in carbohydrates is actually detrimental to sperm count, and numbers will go down. So a client trying to support his wife, went on the Atkins diet with her in order to help her lose weight, and his sperm count dropped drastically over the 3-month period that he was on the Atkins diet. So it is very important to have a balanced diet and getting all your mineral and vitamin supplements as well.